Here's what's coming up on today's show.
And then as you are into retirement, maybe some things come up and you want to shift some of that cost and risk to an insurance provider, and you would shift that policy accordingly. It's important to know what some carriers will and won't do for you before you sign up on that first day.
Welcome to the How Money Works podcast with Craig and Jennifer Moser of Maestro Wealth Advisors, serving you throughout the Triad of North Carolina for more than 30 years.
We're going to talk about Medicare a little bit here today on the program, so stick around for some great conversation there. And guys, what's going on this week? How you doing?
We're doing great. We've been celebrating birthdays out the wazoo on the Moser side.
On the wazoo,
we have like 4 birthdays in the course
and
of...
the last one is my Aunt Rose, who turns 95.
Yes.
Nice.
Still rolling.
Yeah.
Man, you got some longevity on your side, bud.
I tell you what, my dad's 96.
I'm saying.
You guys might have to listen to this radio show
A long time.
perpetuity.
A long time.
Long time.
Or maybe not.
Well, you'll probably definitely be on Medicare at that point, so I guess it's a good conversation to have this week, right?
It is, and that is the first topic of the show today, is really talking about Medicare. And we get a lot of questions as people are approaching retirement. They're used to their health insurance, at their employer. Maybe they've gone to the marketplace and done the traditional health insurance, but then there's a big, black hole of Medicare, and Medicare being a government basically program eligible for most U.S. working adults. Once you reach 65, you're eligible, and there's certain requirements around, when you enroll and that kind of thing.
So I guess let's just do a couple of basics. Let's run through a few, like you said, Jen, high level on Medicare. Should we start maybe with just the components? Because I think a lot of people probably have the big three kind of figured out, but there's a lot of other ones as well. But why don't we just run through those real fast?
First of all, there
You're
is
not Jennifer.
Part A. Well, you woke me up. I thought I'd talk a little bit.
Let's go.
I've got a throat in the voice. Just kidding.
Okay, so Part A is basically insurance for everyone over 65 that just covers hospital care. So don't think about the doctors, but it's hospital care, some limited coverage for skilled, key word, nursing care, home health care, and hospice. And for Part A, there's typically no premium that you pay, but there is an annual deductible. So, and then it has co-insurance if you stay past 60 days, past 90 days, that type of thing. So the first $1,632 is your Part A deductible. Medicare also has Medicare Part B. Now, that's the part that when you go on to Medicare, Part B, they're going to want you to pay for. And so it covers doctor visits, preventative care, clinical research, some medical equipment like wheelchairs and walkers. It comes with a monthly premium. And if you're taking Social Security, they'll take it out of your Social Security check. If you do not get Social Security, you're somebody that's going to push your Social Security, say, to 70, then you got to pay them. There's annual deductibles and there's co-pays. As a general rule, your first deductible is $240, and then they pay 80% of what Medicare approves, which may not be what the provider charges, but yet again, this is just a high-level overview of what A and B are. Jennifer, talk about D.
Well, let me talk a little bit about Part B. So Part B is the piece that you're actually penning a check for, typically, or it's coming out of your Social Security. That is pegged to your income. So if you are receiving a lot of income, you might have to pay more than the base fee of $174.70 a month for that. So higher wage earners, you will be paying more for that benefit of the Part B.
Of course, they get more, right?
No.
Sorry,
no, they do not get more.
Cynicism on my part.
So we're talking about Part A, Part B. Part D covers prescription drugs. Think of D for drugs, and comes with still more additional premiums, co-pays, and deductibles. And again, there is particularly a base charge for D, and as your income increases or higher income, you might have to pay more than your neighbor or someone you work with because their income might not be as high as yours. So those two are pegged to your income.
Is that the IRMA? Is that IRMA? Is that what you're talking about? Income related?
Yeah, the increase in premium if you have a higher income. Yeah.
Okay, gotcha. Okay.
Get caught with Irma. I don't know who she is.
Well, I was going to say, it's funny.
But it's not good.
Yeah,
and she charges more.
It was funny that you say that because I was always taught that I had the aunt and uncle that had their hand in my pocket, and it was Uncle Sam and Aunt Irma. And I never could figure out who this aunt. I mean, the Uncle Sam one I got, but
well, it's good that you had that epiphany on this show.
Yeah, exactly. So let's run through some basic misconceptions that people might have about Medicare that might want to be clarified because there's some pretty standard ones I think most people are a little unsure about.
Yeah, well, the first one is Part A. So, and it's kind of the timing. If you're already on Social Security, you're automatically going to be signed up for Part A. Typically, Part A doesn't cost you anything for most Americans and wage earners, but you still have a deductible, so it's not totally free. You shouldn't just enroll and stick with the same plan on autopilot every year. So there are some programs, whether you start with a plan that doesn't have a supplement or an advantage or one that can shift to the ability to do that supplement depending upon your health needs over time. So if you think about it, you might be the healthiest you are when you first retire. And then as you are into retirement, maybe some things come up and you want to shift some of that cost and risk to an insurance provider, and you would shift that policy accordingly. It's important to know what some carriers will and won't do for you before you sign up on that first day.
So in basic terms, Medicare is not free, guys. You know, you've paid for that throughout the years. Part A has a deductible and it seems free. So the hospital part doesn't have an ongoing premium cost to you, but Part B will have a cost. It has a deductible as well. It's about $240 a year. And so just understand that in addition to that $240 for the healthcare costs in a year, you have to pay 20% of the copay amount, and you might have to pay extra if the charge is greater than that and the doctor doesn't accept what Medicare approves. Medicare Advantage and Medicare Supplements are two different animals altogether. Now, the Advantage plan is similar to the old HMO or PPO plan where you work with a network of doctors and you know, the plan that you have. So you know the favorite names. I'm not going to say them on the radio, but there's a lot of different providers, and they have their network of physicians that like that particular insurance provider. The Medicare Supplements cost a little more, frankly. And if you get the big Dinah Whopping one that pays 100% of everything, then, you know, you're going to pay out of pocket, but you also have a policy that's good in California or here or any place else without any changes to what you might have to pay. Now, I didn't say that your Medicare Advantage plan won't pay in California. I'm saying that the cost structure might be a little out of that network of providers.
One thing before we break on Medicare, what doesn't it cover? I mean, we talked about what it does cover. What doesn't it cover? Yeah. Medicare Part A's and B's it doesn't cover routine eye exams, dental care, hearing aids, acupuncture, routine foot care. So truly is the medical side. So it doesn't include all those other activities. So you do need to make sure in your retirement plan you've saved money and you can account for those things if you need those assistances with dental and eye and all that kind of stuff.
Well, some of the insurance will pay for some of that.
I'm just saying parts A and B by themselves.
Of Medicare itself.
Right,
yes.
don't pay.
Thank you so much for checking out the podcast today. If you have any questions about what we've discussed, remember, you can get a complimentary financial review with the team at Maestro Wealth Advisors by calling 336-448-1086 or go online to howmoneyworksradio.com for other great resources and ways to reach the team. You can also check the show notes of today's episode for our contact information as well. And don't forget to subscribe to the podcast on your favorite app so you never miss an episode. We're on Apple Podcasts, Spotify, Google Podcasts, and all the most popular apps. For Craig and Jennifer Moser, I'm Mark Killian. We'll talk to you next time on the How Money Works podcast. Craig Moser is a financial advisor and certified financial planner. Securities offered through Avantax Investment Services, member FINRA SIPC. Investment advisory services offered through Avantax Advisory Services. Insurance services offered through Avantax Affiliated Insurance Agency.